ticks. Anaplasmosis is another disease caused by ticks. Ticks transmit the bacteria to humans. It tends to resemble the flu, and you're getting that phagocytosis of the bacteria, like the cell is literally engulfing the bacteria. It's inside the cell, going to replicate, and then it's going to kind of like exocytose it out, and this is really rickets. It's going to do that with. Here is a bigger one. Here's the release of the rickets there. Good times. Okay, so no. What else? Here is, it actually happens in the general distribution of both of these diseases. The common name rickets is something that does happen in Missouri. So again, let's not get bit by ticks. This is the same question that I feel like I've asked you maybe 3 times. Health departments often recommend that outdoor enthusiasts wear light-colored pants while hiking in areas where they're called LXO ticks, deer ticks, essentially, the little tiny ones. Why? Why would you want to do this? Why would you want to wear light-colored clothing? Remember what I said? It was hard to diagnose because you didn't think you were bitten by a tick because they're not those big old ticks. They're little bitty tiny things. So when you wear light colored clothing, you're more likely to notice that you have ticks on you. And so then when you get those symptoms, you'll know, hey, I was in the woods, I was hiking, and I did notice the presence of ticks. So that is why they're asking you to wear light colored clothing when you know that you're going to be around deer ticks, the little bitty tiny guys. Yellow fever. I mean, this just keeps getting more fun, doesn't it? Yellow fever. You get a fever, headache, muscle aches. There's a little bit of a period of remission, and then it's bad. Then delirium, seizures, coma, hemorrhaging, damage to the liver and kidney. It's caused by a virus called the yellow fever virus. And guess what it's spread by? Mosquitoes. I feel like mosquitoes and ticks are the bad guys of this story. They are the villains in this story. Here is my nemesis, the mosquito, right? The vector of yellow fever is a very specific type. So symptoms of yellow fever, you tend to get yellow in your eye and you just turn like kind of a unpleasant yellow color. That's why they call it yellow fever. Transmitted by the bite of the Aedes mosquito. I don't care. I don't like mosquitoes at all. It doesn't really matter what kind. But this very specific one actually transmits yellow fever, mostly in South America and in the continent of Africa. Mono, infectious mononucleosis. Severe sore throat, fever, again with the swollen lymph nodes. Do you see how our cardiovascular system is connecting with our lymphatic system? And you're getting the swollen lymph nodes as very often a symptom. Fatigue that lasts for months. If you know anyone or have ever had mononucleosis yourself, you know that this just like, it's months and months of just extreme fatigue. Pathogen and virulence is Epstein-Barr, is the causative agent of mononucleosis. EBV establishes latent infection in host and suppresses apoptosis of infected B cells. So what's supposed to happen is you have your MHC platform and someone's supposed to come along and apoptose you, and that doesn't happen. So it spreads the virus. Here's some delightful pictures of that, what that looks like. Here's this really swollen lymph node there. Okay, more on mono. Again, transmission occurs via saliva. It's often caused the kissing disease. Congenial cytomegalovirus. Galovirus. I don't know why I can't talk today. Sorry. This is asymptomatic in most cases. So this virus is something that it doesn't only occur, but it's mostly symptomatic in newborns because its birth defects can occur when the virus infects stem cells in the embryo or the fetus. So it's something that we really look for when we're talking about pregnant women. It's caused by CMV. So cytomegalovirus is called CMV. It establishes the latent infection in the host. What else do we need to know about this? This is what I was saying. Transmission is by direct contact with bodily fluids or in utero exposure. And the most common, most talked about probably is the in utero exposure. One of the most common infections for humans, and infections typically last for life. So diagnosed by treating in large cells with inclusion, and most of the treatment is ineffective, and there's no vaccine available. And here is what it looks like. It's called owl's eye. So see how that looks like an owl? It does. It looks like an owl's eye. So that is another, CMV is often called owl's eye disease because when you look at it under a microscope, under a stain, it looks like an owl's eye. Okay, dengue fever and hemorrhagic fever. Many cases are asymptomatic. Dengue fever, edema, head and muscle ache. Again, our friend, the Aedes mosquito. So 0 out of 10 with mosquitoes today. Bad. So basically, there's just 2 types. Both are spread by by mosquitoes, initial infection, and then you get the dengue fever. And then that can also spread to someone else, or you can get the same directly from the mosquito. Again, is usually a mild disease. The dengue fever is usually a mild disease, but dengue hemorrhagic fever is severe and can be fatal in many cases. Diagnosis is based on signs and symptoms of people who have traveled to endemic countries and possibly been bitten by those kind of mosquitoes. African viral hemorrhagic fever. Again, fever and fatigue, minor petechiae, progress to several internal hemorrhaging, death results in shock, seizures, or kidneys, caused by several different RNA viruses, Lassa virus, Ebola virus, and Marburg virus. These all you had on note cards, if you remember. Here's Ebola virus in the orange budding from infected cells. So if you remember anything about some of these, the Ebola virus, this is people carrying these, but the main symptom is you're actually bleeding from your eyes. So that's one of the main characteristics. This is a later stage. Damage to blood vessels can cause severe internal hemorrhaging as well as bleeding from other body orifices, including your mouth and eyes and ears. So it's bad. So there we go. It's occurs primarily in Africa, transmitted via contact with bodily fluids. The mortality rate is from 25 to 90%, depending on which strain of the virus. Here are places: Ebola, Lassa, and Marburg, where it is infected, and you will see that we do have some Ebola. We do have a case in the United States that has been known. Here is a chart with our friend, the hemorrhagic fevers: yellow fever, dengue fever, Ebola, Lassa, and Marburg. Natural host: humans, monkeys, probably bats for Ebola. The African soft-furred mouse, probably bats again, and the vectors are, in these 2 cases, mosquitoes, and there's really no other vectors here. It just happens. So just because it goes from bats to something else doesn't necessarily mean. Somebody probably ate a bat, came in contact with a bat, got pooped on by a bat. It's really hard to know. Okay. Epstein-Barr virus causes chronic fatigue symptoms. Many others deny the association between Epstein-Barr and chronic fatigue symptoms. Why are the symptoms debated even though Epstein-Barr virus is present in CFS patients? This goes back to our very first chapter with Koch's postulate. So Epstein-Barr is present in 50% of the population. So 15% of the population actually carry the Epstein-Barr virus. However, 50% of the population does not have chronic fatigue syndrome. Does that make sense? Just like do that math in your head for a second. 50% of the population has Epstein-Barr, but 50% of the population does not have chronic fatigue syndrome, and those two don't match up. So you don't have like 50% of the population and then a matching. So Koch's postulate says this does not demonstrate the proper response. Malaria, associated with parasites, life, fever, chills, diarrhea. At least 4 Plasmodium species cause malaria. Disease severity depends on the species, and there is some other diseases that cause the most severe types of malaria. Children are particularly vulnerable to infection. Okay, so you know what? We're going to just talk about this in another video because we need to talk about malaria and sickle cell disease.